It's our pleasure to welcome now Dr. Dan Edney. He is the State Health Officer with the Mississippi Department of Health. Dr. Edney, always good to see you, sir. Thanks for coming on.
Oh, thank you, Gerard. I'm sorry I couldn't be in the studio with you. I'm on the road in North Mississippi today, but always happy to join you.
Yeah, well, we appreciate you taking a little time out to give us an update on what's going on at the Health Department. This is Public Health Week, it is our understanding. What does that mean, Dr. Edney, and what are you focusing on with respect to that?
Well, it's an opportunity for us to celebrate all things public health, to celebrate our workforce, the folks who work passionately to help keep not only Mississippi, but America healthy and safe to the best of our ability. Since 1877, we've had organized public health in Mississippi when the Board of Health was first organized, and certainly now in the modern era, I'm very proud to serve on the front lines of public health and remind everybody that public health does indeed save lives.
Yeah, absolutely. Well, that's good. So you said you were in North Mississippi, so are you promoting that? Are you traveling this week, delivering that message?
Well, we have county health departments all over the state and have work all over the state. So I spend about 30% of my time out in the field, traveling and seeing the good work that's going on all over the state, encouraging our workforce and, keeping myself up to speed of what's going on in the field. You can't do it from an office in Jackson, I can tell you that.
Absolutely. So it's our understanding, Dr. Edney, that there was a Board of Health meeting this past week. Is that correct? And what was that about?
That's right. Well, the Board of Health meets once a quarter, and the Board of Health is where the Public Health Authority resides statutorily, and then as a state health officer, I'm the individual tasked with carrying that out. So the Board of Health oversees the good work of the State Department of Health. I direct report to them. They are the ones who approve our regulatory action, who helps us with the public health agenda. And so, every 3 months they convene in Jackson to receive reports on what we're doing, updates on what's going on in public health, and then oversee the work that we do.
Gotcha. What's going on from Washington? I know last time you and I talked, you had expressed some concerns about perhaps some restructuring of federal funding that we receive here in Mississippi, as do all the states, related to public health. How are you dealing with that? What does that look like?
Well, as you probably have seen reported, we had rescission of over $200 million of the residual pandemic response funds, and it's important for your listeners to understand that that was not $200 million we were using to fight COVID at this point. The pandemic is over. We're grateful that it's over. Very proud of the work the State Department of Health did through the pandemic, and many folks in Mississippi are alive today because of that good work. But the hurricane has passed, but the damage is still there. And the damage is to public health. And y'all know we're watching the bird flu situation. We've been fighting to contain syphilis, and now we're trying to be ready for measles, whatever it's going to do. We're dealt with the recent pertussis whooping cough outbreak in the state, and it's up to us to survey that and to recognize it and to intervene in a way that keeps everybody safe. And that's what you expect us to do, and it's what we're supposed to do. And we were using those funds to rebuild our infrastructure, our workforce, improve our data collection, our surveillance abilities, our reporting abilities, to make it easier for providers all over the state to report the things that by law they have to report. And so all across the country, those funds were being used for those purposes. Things like upgrading the public health lab to be able to respond in the 21st century the way that we need to, and not just being left to how we were in 2019, but preparing for 2030. and I equated those to very much like the Katrina recovery funds. After Hurricane Katrina was over, we had a lot of rebuilding on the coast. It doesn't make sense to me that we would have stopped the rebuilding efforts after Katrina or in Rolling Fork or now Walthall County tornadoes, that we would stop halfway through. And that's unfortunately what we have done. But that, I think, came about from a misunderstanding of new HHS leadership, not realizing what we were doing with those funds, and the negative impact to public health in Mississippi, and not just the Department of Health, but all of our partners all over the state, the contractors that we work with, our community partners that we fund to help us get the work done. And it's unfortunate, but we're getting through it okay. I'm being asked what have been our priority changes related to the loss of federal funding. I said none whatsoever. That Washington does not dictate the public health priorities of Mississippi, and I have been determined since I became state health officer that we would be less reliant on federal funding, and that we would not allow federal grants to decide what we did or did not do in terms of keeping the people of Mississippi healthy and safe. So the core public health mission of the Department of Health is not changing. The funding streams are changing, but our work has to go forward.
How has this new administration, Dr. Edney, with Secretary Kennedy in place over HHS, how has that changed things for the Department of Health here?
The biggest change has come through the reorganization of the CDC and HRSA and SAMHSA. HRSA deals with a lot of rural health issues and maternal child health issues, SAMHSA with mental health issues, and by extension out to us. I have to remind our federal colleagues in the delegation that 80% of the funding of these federal agencies flow out to the states. So be careful when you hit the CDC, you're hitting us harder. But I'll be the first to tell you, as a good conservative guy, that the federal budget is out of control, has to be reined in. I just, for one, would prefer it be done, as the president said, with a scalpel instead of a chainsaw, and that we make thoughtful reductions, and that we do it in partnership. Just reach out and ask us, what are we doing? How are we doing it? What do we need? What can we give up? And I'll be the first to give them that good information. And I think there's just some growing pains happening at HHS right now that we'll get through. I just hate that I'm having to feel a bunch of the pain right now.
Have you expressed any of your concerns, Dr. Edney, to lawmakers, to the governor, perhaps?
I have, and they've been very responsive. Right now, it's important to know that really the way the State Department of Health is funded is from the indirect costs that we receive off our grants, mainly our federal funding. So that percentage that HHS assigns to us every year, that we get it, that's what runs the agency, and that I have opportunities with alternate funding to plug holes. I think certainly the governor's team, legislative leadership knows I'm really reticent to try to dip into state resources any more than absolutely have to. And right now we're able to backfill some of our responsibilities and the impact to our budget ourselves, and that's what I intend to do. I'm just needing to know if more cuts are coming to public health, do it in a way that we can prepare for it. So I'm not just getting an email at 6:15 in the morning saying, hey, $200 million being pulled back.
Yeah. Well, I know you're looking at your budget. You're thinking about the revenues that are going to be available to you. Of course, right now you're somewhat in the dark about that because we don't have a state budget that's been signed into law. So I'm sure that's a little stressful as we wait to get that hammered out, and hopefully that's going to happen here pretty soon. Dr. Edney, always a pleasure to talk to you, sir. Appreciate you coming on, and thanks for all you do for the state of Mississippi. Appreciate it, man.
Thank you. Thank you, Gerard. I appreciate it.
Yes, sir. Dr. Dan Edney, he is the State Health Officer with the Mississippi Department of Health, has been our guest on middays. We're in the Element Well studio, coming right back.